What does it mean if you see a faint line on your home pregnancy test? Could you be pregnant? Or is what you are seeing just an evaporation line? Today at Femhealth, we are diving into what you need to know. First, let's talk about evaporation lines. An evaporation line is a faint, often colorless or gray line that can appear on a pregnancy test after the recommended time limit. For most tests, this is about 10 minutes or more after testing. Evaporation lines are caused by the urine drying on the test strip, leaving behind a shadow or streak where the test line would normally appear. Blue dye tests are more likely to show evaporation lines, and they can be tricky because a dried up blue dye can look like a faint positive. Pink dye tests may be easier to tell the difference between a true line and an evaporation line. Evaporation lines do not indicate pregnancy, so it is important to follow the test instructions closely and read the result within the time frame listed, which is usually within 3 to 10 minutes. If you look at the test after the time limit, any line you see may not be trustworthy. If a faint line appears within the recommended time frame, even if it's very light, it is usually a positive result. But why might the line be faint? And what should you do next? Home pregnancy tests work by detecting the hormone HCG. Your body produces HCG after a fertilized egg implants in your uterus. A line, even if it is a faint line, means the test has picked up some level of this hormone. Most tests are very sensitive and designed to detect even small amounts of HCG. That's why you might see a very faint line if you're early in your pregnancy or your hormone levels are still low. There are a few common reasons why a pregnancy test line might be faint. One reason is testing too early. If you test before or right after your missed period, your body may not have built up a lot of HCG yet, resulting in a lighter line. Waiting until after your missed period can be helpful. Another reason for a faint line could be very diluted urine. If you drank a lot of water before testing, your urine may be too diluted for the test to pick up high HCG levels. The best time to test is with your first morning urine, which is more concentrated and more likely to give accurate results. Also, some tests are more sensitive than others. A test with lower sensitivity might show a fainter line even with the same HCG levels. So what should you do next? If you see a faint line, wait 2 days and test again. Be sure to inform your doctor so that they can provide guidance on proper prenatal care, including taking an appropriate prenatal vitamin. In early pregnancy, HCG levels typically double every 48 hours. If you're pregnant, the line should get darker over time. If you don't want to wait 2 days, you can also schedule a blood test with your doctor. Blood tests can detect even smaller amounts of HCG and confirm your pregnancy with greater accuracy. Consider also watching this video on chemical pregnancy, which can also provide more education. Remember, when taking a home pregnancy test, read the test result within the correct time window. It is important to follow the instructions exactly. In most cases, a faint line in the right time frame does mean that you are pregnant, but always check with your doctor to be certain and get personalized recommendations.